Hello, everyone. What I've been asked to do is talk a little bit about how a society like SAGES can take a leading role in some of the issues that you've heard today when it comes to new technology and getting that new technology to a point where payers and the FDA are aligned in allowing us, the physicians, to bill and collect for services provided. The thing that a society like ours can do is essentially look at new devices that the FDA clears and ask our membership whether our membership feels strongly that that's a device that's worth looking at. And then we, the society membership, look at that device through a technology committee that we have here with lots of experts and decide if we think it's helpful. We've heard the standards that we have to go through, the safety, the efficacy, and the value. And so what you see here in front of you is there are many new devices and technologies and advances that achieve regulatory approval, leaving patients with surgeons wondering where the new device might fit in their practice. And this is going to continue to happen. Physicians and healthcare systems ask, can or should I bring this into my practice and accept to either significantly improve the quality of care or reduce costs? And I think those are very important issues, as we've heard so far. A value assessment will review available data related to quality and cost and assign a determination as to the value the device might represent. And this obviously helps not just the payers, but it helps the patients, hospitals, and other individuals. The committee's charge, therefore, is to evaluate and make evidence-based recommendations regarding the adoption of new and existing technology, to assess new technology or equipment and evaluate the financial basis of the acquisition and/or the per-case costs of utilizing such technology, to assess the impact of new technology on a physician or hospital's practice and ability to provide innovative and modern care. So this aligns very nicely with what everybody wants us to do. They want to know, is this worth it or not? The Technology and Value Assessment Committee considers new devices and technologies which are FDA approved for sale in the United States. A review by the TAVAC of a particular device or technology can be requested by any SAGES member. After a preliminary review, the technology will undergo a more detailed assessment within one of several possible designations. So one assessment option is the safety and efficacy assessment. This is for new technology that really doesn't have a great deal of data with it. Maybe some primary PMA work, or if it's a 510K, maybe something along those lines. So that is appropriate for any device recently approved by the FDA where there's sufficient data available to make determination of safety and efficacy, but perhaps not of value. This would typically involve a device that went through the PMA process, the FDA process. With the PMA process, there's usually the requirement of more clinical data. Then with the 510K, these clinical data may be sufficient to allow SAGES to determine the device to be safe and effective for the intended use. While the FDA has also made such a determination, the FDA approval alone often does not convince patients or payers of the device's safety and efficacy. This usually is due to a limited number of credible and unbiased experts presenting the data to the FDA advisory panel. The SAGES TAVAC assessment of safety and effectiveness of a device would bring added value to the process of getting new technology into the hands of our members and the use in the patient. So this is a service that we think is important to provide. A value assessment requires a lot more than safety and efficacy data. It requires outcomes. And so you can look at this equation as value equals quality of care, i.e. outcomes, and cost of that care. And that's not always an easy thing to gauge. A technology alert is something else that we're doing right now. What we find is that the only way for us to get notified of a new technology or a new approval is usually when the marketing or the sales rep show up together with information to us, and that's biased information. What we want to do is provide to our membership an unbiased way to look at what are some new clearances where the FDA's just come out. There may not be sufficient data to determine much more than it's an alert. Maybe it's really early on, but this process allows approval based on a predicate device where the new device is sufficiently similar to an existing device not to require phase 1 or phase 2 clinical data before approval. So basically these are approvals, 510K, so almost for certain, that don't have the big PMA data that usually comes along. In this case, a technology alert would detail the intended purpose of the device, summarize the claims by the manufacturer, and speak to the areas where the technology is determined to be potentially useful once further clinical studies are available. Invariably, such a statement ends with the need for clinical studies before any further evaluation can be performed, i.e., by their nature, these are early alerts with not enough information to make full recommendation. So what's the committee done recently for our membership? Number one, we've assessed the LINX device that was passed by the FDA a little while ago. Since posting that LINX device assessment on the webpage, we've had 3,400 downloads. I can assure you that's a heck of a lot more than that article has been viewed on the web. We are seeking ability to publish future reviews in the journal as well, because I think we need to disseminate this. The tech alerts initiated and written, we've had a couple done so far. And that the technology committee also hosts something called the Emerging Technology Session, which has about 150 abstracts per year submitted. We take about 13 oral presentations. The rest are, if they're worthy, go to the exhibit for posters, and you can look at that. And the session is this Friday from 3:30 to 5:30. Usually it's a packed house because it's the latest and greatest from the manufacturers as well as scientists on new technology. And many of these technologies in emerging tech may not have FDA approval, but may be just beginning. The 2 tech review articles were published in the journal. We do tech review, so what we'll do is we'll pick a tech review on 3D technology and say, whether we think it's worth it or not. This is a typical tech alert. I know you can't see it. It doesn't matter. It'll be up on the web. This is just an idea. One is a new fascia closure device which got approval, and the other one is a curved stapler for colon operations. Again, this just talks about what was shown in the FDA clearance, with a couple of comments from us saying what we think is, what are the claims that we think are surgically relevant. This is what the TAVAC safety and effectiveness analysis looks like on our web, and this is what was downloaded 3,900 times. That's been there for just a little bit less than a year, so we're very proud. We think this is a very important service. And we've now started a review on the safety and effectiveness analysis for Vinci surgical system, a hot potato indeed. You can see the people involved. Dr. Sean Suda is going to be the chair of this committee to review it. Dr. Gold, Azagari, Sandler, and Hutter, who's going to be taking over from me as the TAVAC committee chair, Dr. Ross, Haas, and Satava, and these are all people who have been vetted with no conflict of interest, and what they're going to do is go through the data and carefully ascertain whether we can place a safety, effectiveness, and value statement on the current Da Vinci technology. While I cannot share with you the document as yet because it's being developed, I can tell you that in looking at making these determinations, you run up against, interestingly enough, a significant lack of very good randomized prospective or controlled trials to show things like outcomes and things like cost. Those are not usually reported in the literature, and which is why I think a society like ours needs to promote that type of investigation so that the payers can actually make those decisions, not arbitrarily as they do today, but based on some data. But we need to be responsible for helping provide that data. In conclusion, SAGES needs to maintain leadership in new to surgical technologies. I can't think of any organization better suited than us. Peer review by committee is the best way to present innovation to the membership because we are experts truly in this area. Transparency and complete disclosure must be observed to avoid conflict of interest and to make sure that the documents we publish hold up to scrutiny. Thank you.